All right, let's talk about something that's, absolutely essential for every medical practice, but is also a huge source of frustration for so many. We're talking about healthcare reimbursement. We're going to break it all down, why it's so confusing, and more importantly, how you can start to get a real handle on it.
So, does this sound familiar? You're doing incredible work, your team is going full tilt, but then you look at the books, and something's off. The numbers are heading in the wrong direction, and you can't figure out why.
And look, it's so easy to think the problem is somewhere inside your practice. But what if it's not about how hard you're working? What if the real issue is hiding in plain sight? We're talking about a system that's just loaded with these hidden tripwires that can work against you, even when you're delivering the absolute best care.
So let's just dive right in. Section 1, the problem with pay. We're going to get into exactly how this whole system can squeeze your practice's financial lifeline.
I mean, think about it. Every single claim you file is the lifeblood of your practice. But as soon as you send it, it kind of disappears into this fog. And what comes out the other side is decided by things you can't really see. A mix of government formulas and these really intricate private payer contracts that pretty much dictate your financial health.
So, let's step inside that fog, shall we? Welcome to Section 2, the reimbursement maze. We're about to see why this whole thing feels less like a straight line and more like a labyrinth you have to navigate.
Okay, so right at the center of this maze is a federal system that really sets the stage for almost everything else. You've probably heard of it. It's called the Resource-Based Relative Value Scale, or RBVS for short. It's the bedrock of how Medicare figures out what to pay.
And in theory, it's actually a pretty smart system. It tries to standardize the value of a service before you even put a dollar sign on it. It looks at every single thing you do and breaks it down. How much time did it take? What skill level was needed? How intense was the work? It assigns a value to that and then multiplies it by a national number to get the final payment.
But, and this is a huge but, here's where the maze gets super twisted. Private payers, they see that Medicare formula as just a starting point. Then they start layering on their own unique adjustments based on where you are, what your specialty is, and this is the big one, how well you've negotiated. And that means two different clinics can get paid two wildly different amounts for doing the exact same procedure.
And that leads us to a really critical point that so many people miss. This isn't just about the money, it's a legal issue. So, for Section 3, we're talking about contracts, a hidden risk. This is where the real danger can be hiding.
Every single rate you get paid is written down and, in theory, protected by these legal contracts between you and the payer. But if that contract has vague language or really unfavorable terms buried in the fine print, well, it can just quietly bleed your practice dry for years without you even realizing it. So, how do you flip the script on this? It's time to stop thinking about the problem and start focusing on the solution. The whole idea is to turn your contracts from a liability into an asset, a tool that actually helps you grow. It's really about taking back control. And when you get this right, the impact is, well, it's huge. Section 4 is all about the ripple effect, because getting your reimbursement strategy dialed in doesn't just help your bank account. Nope, it sends positive waves through every single part of your practice.
Seriously, it's all connected. If your rates are too low, can you really afford to hire and keep the best people? Can you invest in that new piece of equipment you need? Can you even think about expanding? From staffing to technology to growth, having a stable, predictable revenue stream is the foundation for pretty much every big decision you make.
And then there's the legal side, which can get really serious. This isn't just about getting paid what you're worth, it's about protecting your entire operation. Vague terms in a contract could actually put you at risk for audits or penalties under major laws like the Stark Law or the Anti-Kickback Statute. Getting this part wrong can have massive consequences.
Okay, we've talked about the problem, the complexities, the risks. So, now what? What can you actually do about all this? Well, that brings us to our final section, negotiating for fairness.
Let's be honest, going up against a giant insurance company can feel a little bit like David and Goliath. It's intimidating, for sure, but here's the thing. It is absolutely possible to negotiate for better terms. The key isn't to pick a fight, it's to be prepared. It's about showing up with data, with clarity, and with a real strategy.
Having a game plan like this turns what feels like a scary confrontation into a straightforward business process. You start by analyzing your current rates, seeing how they stack up. Then you pinpoint the unfair terms or the outdated fee schedules. You use your own data to build a case for why things need to change, and you make sure that whatever you agree to is totally compliant.
And at the end of the day, that's what this is all about, fairness. The work you do for your community is essential. It's life-changing. You absolutely deserve transparency, and you deserve to be compensated in a way that truly reflects the incredible value of that work.
So I'll leave you with this question to think about. What could you accomplish if you could put 100% of your focus back where it belongs, on your patients, without that constant, nagging worry about the bottom line? Really taking charge of your reimbursement strategy isn't just about business. It's about building the financial stability you need to do what you do best.